So it is my great pleasure to welcome on stage our next session. I had the pleasure of meeting these folks last night, so it feels like I'm welcoming friends on stage, which is nice. I'd like to introduce the moderator today, Dr. Ruth Freeman, Director of Strategy and Communication at SFI. Our esteemed guest, Mark Pollock, with his colleague Nick Terrafranca. Nick is the Chief Executive Officer of Neurorecovery Technologies. I know that people are still gathering and en route from the other room. But basically, you want to start? Yeah. So prepare to be blown away by Mark Pollock's story, transforming lives with science and technology. And without further ado, I'll hand over to Dr. Ruth Freeman.
Yeah. Thank you very much, Susan. It's great to be here. So as Susan said, I'm the Director for Strategy and Communication at Science Foundation Ireland. And I guess we're the lesser-known agency of our sister agencies, Enterprise Ireland and IDA. But just for those of you who don't know us, we're the Irish government's largest funding agency for research. We were set up about 13 years ago. And in that time, we've made commitments of over $2 billion to research in Ireland, which has been 100% funded by the Irish taxpayer. So I always think, for Irish people who are overseas, it's good to let you know that we've sort of become a player in the world of research and technology. We very much used to not be a player, but now we're ranked in the top 20 globally for science and technology. And I guess, that's across every field, but there's some fields where we're doing very well. So we're ranked first in the world for our immunology performance. We're ranked third for our nanoscience, fourth for computer science, and very relevant today, we're ranked 9th in the world for our neuroscience and behaviour. So that's just a little bit about Science Foundation Ireland. I'm really privileged to be here sharing the stage with these two men. Mark Pollock, who's a collaboration catalyst and explorer at the Mark Pollock Trust in Ireland, and Nick Terrafranca, who's the CEO of Neurorecovery Technologies, who are based in California. I guess this session really focuses on the power of collaboration to impact lives. And, at SFI and with Mark and Nick, we're very excited and focused on enabling collaborations between science, technology, academia and business to make those impacts happen. Before we start, we'd like to show you the trailer for Mark's documentary film, which is an amazing documentary, and I would encourage you all to try and see the full film. It's called Unbreakable, the Mark Pollock Story. Could you play the video, please?
I, for a long time, have been trying to work out who I am and where I fit.
Going to meet a man who's living proof of the power of mind over matter.
Do you like that?
You're aiming to be the first blind person to get to the South Pole.
He was the essence of happiness. There's this guy who can't see and he's just in love with the world.
It's my 10th anniversary of going blind. Going to the South Pole really marked the journey that I'd been on, from zero confidence to being able to deal with it and move on. You got to do these things in life because you never know what will happen.
I remember looking, it was like almost in slow motion, just seeing Mark falling down.
My phone rang. Mark's had an accident and he has hurt his back.
A lot of people just die, and that was on the cards.
He was in absolute pain, wanting this to stop. He can't feel or move his body below his stomach, and that's horrific.
I can look at this in two ways. I can either hope and seek out a cure, or I can spend my life getting on and living my life.
You're the best.
He's realised the voice that he has and his ability to move people.
If I just sat in my wheelchair, I'd be giving up completely.
we can change the physiological properties of the spinal circuitry to generate these movements.
I was saying to him, your next adventure is this.
I feel like an explorer operating on the frontiers of what's possible.
So, Mark, that's the trailer for your amazing documentary, which has been screening around Ireland for the last few weeks and hopefully will screen here in the US soon. It describes how you've been pursuing your mission at the Mark Pollock Trust to, I guess, find the people and connect with the people who can fast-track a cure for paralysis. But before we deal with the paralysis, I just want to ask you about your blindness. You lost the sight in your right eye when you were 5. Can you tell me what happened when you were 22?
Yeah, but back in the good old days when I could walk and see, I was 22. I was in my final year in Trinity College, Dublin, about to graduate. I was rowing, or crew, as you say in the States, for the university and also for Ireland. And then I had a job offer to start in finance in London after graduation. So, as you say, I'd lost the sight in my right eye when I was 5. And when I was 22, I was down at the boathouse, down at the rowing club, and I noticed blurring around the edge of my vision as the sun dazzled on the water. And I knew I'd seen that before. It was the retina detaching, and in the space of 2 weeks, I had another detachment. 2 operations later, I was blind, but it went very, very quickly. And I suppose for someone who's not blind, I was heavy under the weight of my own biases because I didn't think blind people worked or studied or played sport, or I didn't think they did anything, in fact. So, you know, suddenly I was one of them, and I had to set about rebuilding or creating a new identity.
Yeah, but I mean, you clearly didn't let it stop you, and I don't know, was it your desire to compete, or as you say, just that building of a life? But I mean, you went on to win medals in the Commonwealth Games, you went on and did incredible races in deserts and mountains, and then as we saw in the documentary, you made this incredible expedition to become the first blind person to reach the South Pole. Can you tell us a bit about that amazing expedition to the South Pole?
Yeah, well, I'd been building up. I'd kind of carved out this career as an adventure athlete, and I'd raced all around the world. But on the 10th anniversary of losing my sight, I wanted to do something that was, you know, a big jump up for me. So it was a race to the South Pole, the first race to the South Pole that had ever been created. An athletic event. I was a sportsman. I wasn't an explorer. It would have been a stretch to be a blind explorer, I think. But I had to get past the gatekeeper, and a lot of polar people are British Royal Marines and or ex-British Royal Marines, and this guy Tony Martin had set up this event. And Tony is kind of short, sergeant major type. He's got a big handlebar moustache, and it seems to be a Royal Marine thing. They've all got these big moustaches, and he speaks with a Cockney accent. He's East End of London, which is another Royal Marine thing. He's from the Midlands. He's not from the East End of London. And I got on to Tony and I started giving him my adventure CV. You know, Tony, I've done 6 marathons in a week in the Gobi Desert. I've run the Himalayas. I've been at the North Pole. You know, and the whole way through he was just going, yeah, clearly bored as I subjected him to the list. And I was building up to say, look, Tony, I appreciate if you've got to check with your health and safety guys, because I'm also blind. And he had no interest in that at all. He did a lot of swearing at that point and said, look, mate, I don't care if you're blind, there is no health and safety in Antarctica, and I'm not, bleep, coming down a crevasse to get you. So I entered the race on those terms. We raised €100,000 from people who didn't want anything back, people who wanted to be part of the team. And we raced over 43 days, dragging sledges against Norwegian Special Forces, Royal Marines, a double gold medal Olympian, and there was me, Simon O'Donnell, and a guy called Inga Solheim. So, you know, I went there and I graduated as an adventurer. I felt I could hold my head up and do sessions like this and actually describe myself as an adventurer.
I mean, you completed that race in 2009, and obviously we just had a clip there in the trailer of the new challenge, I guess, that happened in 2010. Can you just, again, tell us a little bit about that?
Yeah, well, I was back at a rowing event, a regatta, Henley Royal Regatta in England, and I was there. I was going to be there for 4 nights, and I was on the second night after being down watching racing. I'd gone back to bed, and I fell from a second-story window, 25 feet onto the concrete below, and I fractured my skull. I had bleeds on my brain, massive internal injuries, life-threatening injuries, and I had added paralysis to the blindness. So it was a huge change, unexpected. And in fact, Ross, we'd made a documentary about the South Pole, and we had a discussion whether we should keep filming, and because I thought I was going to walk out of there, and it would be a good old story to describe that story. But I started to learn about the reality of paralysis, that it's not just about movement. It's not just about feeling. You also have what are called secondary problems, which are in fact more impactful. A lack of bladder control, bowel control, sexual function, nerve pain, medication, spasms, time in hospital, pressure sores, all of these things which are described as secondary problems, but they're way too embarrassing to even talk about amongst your closest friends, never mind in front of an audience. So I'm glad I know everyone here so well. And that impact, and also the reality that there is, up to this point, there is no cure for paralysis. In the whole of humanity, in the whole of history, there's been no cure, and that's the truth that we had to face into.
Yeah. I mean, I guess as you were sort of coming to terms with the situation, your nature as someone who does things, I guess when you'd had some time to process it, eventually took you to what am I going to do about this? And I guess your first approach was around the physical approach and this idea that if you really pushed your body and exercised, that you would, I guess, do the best with what was left in the system. Can you talk a little bit about, that period?
Well, it struck me that there must be, when those people went to the South Pole 100 years ago, it was impossible to go to the South Pole, and they kept exploring and pushing the boundaries, and eventually they got there. So I figured there must be more. There must be explorers out there not satisfied that life in a wheelchair was going to be the end of the story. And I went back to basics, and I figured, why is all of the evidence, all of the health storyline is to be fit, to exercise? And then as a paralysed person, we were exercising the bits that worked, but totally ignoring the paralysed bits. So I started we flew to California to a place called Project Walk in San Diego. I spent 6 weeks there, and it's like a gym, an elite sports facility for paralysed people, and we rolled in there, and it was filled with empty wheelchairs. People were down on the floor crawling with the help of therapists, standing, squat racks with therapists holding the knees, doing squats, and walking on a treadmill, strapped up in a harness with therapists moving the legs, just to see what recovery, neuroplasticity, this area of rerouting the nervous system, or at a bare minimum, keeping the body in good enough nick so that when all these amazing things that you hear about on the news become available, that I would be ready to avail of those.
And I'm sure that there probably are some of those positives, but I guess it didn't give you the results that you were really looking for, and I guess the next step was becoming interested in robotics.
Yeah, well, a lot of people with spinal cord injury do recover through rehabilitation, and in my case, the injury is a particular, it's bad. Basically, it's as bad as it gets. And 2 years after the accident, I travelled to San Francisco this time, and we linked up with a company called Exobionics, a set of robotic legs, and we've got a video here just to show you what happened sort of 6 months after that. So if we play that, please, the robotic legs video. The reality
is that sitting down in a wheelchair puts you in a different level in the world. I don't know how, over a lifetime of sitting down in a wheelchair, how that's going to impact me. I suspect slowly but surely it's eating away at my confidence or the way I'm interacting with people. When you're standing up, it just feels normal again. That is just really impactful. Psychologically, I get a huge boost just from standing and walking. Mechanically, it stretches my legs out, feel much more relaxed when I get out of the device, and I think it's going to be a big boost whenever I can stand and walk more often. Come on.
So I was able to get a set of those robotic legs, and I walk in them now in the sports hall in Trinity on a daily basis, and I've done over 400,000 steps in them, and all the data from the device goes back to the lab in San Francisco. And the guys in Project Walk were sort of exploring the possibilities. Exobionics are exploring the possibilities of a cure, but as I learned more about the injury and as I learned more about what was out there, we got the real sense that training and walking, was never going to be enough. So we sort of went on a grand tour of universities to meet the scientists who are really working on a cure, to add that into what we were already doing. We went to Cambridge and Harvard and Louisville, and eventually to UCLA, where we met Nick, and we also met Reggie, and we did our first significant collaboration earlier this year in a study walking in the robotic legs, adding electrical stimulation onto the spine and taking a drug which Nick can maybe go into some more detail on. But I've come to learn that there's not going to be one fix. Even if we could get a brand new spinal cord, it's going to be some kind of collaboration, a cocktail of cures to solve this unsolvable problem of paralysis.
I mean, as you say, that's the kind of flat approach that you're looking at, as opposed to a straightforward problem-solving approach. It's about pulling in the right people. So I do want to jump over to Nick now. And Nick, before I ask you to maybe talk a little bit more about the results of the study that you were doing there, can I just tell you, what did you think when you first met Mark?
Mark and I, there are not enough words to describe what Mark is to our program and to everybody he meets. He is just a dynamic individual who thinks of everybody else first and himself second. So when we first met Mark, both Professor Reggie Edgerton, who's the lead scientist behind our work, we knew that we had a new team player and that we were going to do great things with him.
Yeah, and then I guess moving on to this study or this experiment where you had Mark using the exobionic robotic legs. I guess he was keeping up the physical therapy regime, and then you added in the electrical stimulation and then this drug therapy as well. Could you talk us through that study and maybe some of the early results that have come out?
The early results, yes. So just to give you a background, so what we've developed are two electric stimulators for the spinal cord. We have an external system and an implantable system. And they're both designed to address the variety of different injuries that spinal cord injury victims suffer. So they'll either have a partial loss of movement and sensation or a total loss. So our systems are designed to address this population. And with Mark, he has a total loss of movement below his waist. So we experimented with him and applied our external stimulator. And if we can show that clip now. So this is Mark lying down, and we're trying to ask him to move his leg without any stimulation. And you can probably, this pointer, but he's trying to flex his stomach muscles and not much is happening. And then we turn the stimulator on, and we'll ask him to try to move his leg. And after his body adjusts to the stimulation, we'll give him the command, and he can flex his knee. Now, so this, as you can imagine, the first time anybody moves takes your breath away. So to share with you, this is 3.5 years after his injury, the first time he moved, after only 10 days of us treating him for 25 minutes each day. So you can imagine the impact that we can have on all these individuals who have this type of injury. So if you can show the next slide, just to kind of give you... Oh, I'm sorry. That's... No? Didn't work. Okay, so just to show you, this is a graph physiologically. So you can see that before the stimulation, there was some activity in some of the residual fibers going to his muscles. And then after the stimulation, we have an enhancement of the activity that was present, but we also have new activity. And I'm sure you're all trying to figure out how this is all possible. So if we can go to the next slide. So what was recognized by our lead scientist was that the answer to restore movement was rarely within the spinal cord itself. It's not within the brain. So we actually apply our technology below the injury. We take the brain completely out of the equation because Reggie recognized that the spinal cord really has the same sophistication as the brain, that it actually works in concert with it. So when you send out a single command from your brain to tell yourself to move, the spinal cord takes over. It's responsible for all the autonomic processes that take place in our body. The other thing is that the spinal cord can rewire itself. It can repair itself. Neurogenesis takes place, neuroplasticity. And another important thing that was missed was the sensory nerves below the injury are still working. They're gathering information. And our proprioceptive system was key to completing the feedback loop that was necessary. So what we do is we apply stimulation. We identify where and how to stimulate the cord. We wake it up. It recognizes the sensory information that's coming in. It closes the loop, and that's how we bring about movement. Over time, we do reconnect to the brain. And there are weak signals still transmitted through the brain, through the level of injury. And our stimulation, we believe, are amplifying these weak signals to be heard by the spinal cord. So it continues to repair itself, it continues to evolve, and that's how we bring about movement and function. Now, on top of Mark's ability to move here, with the patients we've treated, which have been approximately 20, we've been treating both with our implantable approach and our external approach. We not only regain movement, but we also, with some of our patients, have regained bladder and bowel function. So where this is all going, last slide, please. This is our latest breakthrough. This is our first stroke patient. So on the right, he has hemiparalysis on his left side. He cannot move his left leg. But as soon as we turn our stimulator on, which hopefully we can move him. So this validates that you don't need the brain to restore movement. The answer is within the spinal cord. So now you can really imagine the abilities that we can bring to many, many lives.
Thank you so much. It's just amazing to see that. Well, as I said at the beginning, you are currently based in California, and Mark, I guess very near the end of the documentary, you talk about your aspirations. I guess particularly because you've taken such a leading role in being a voice of this and being at the frontier of the cure, that you would love to bring some of this research and this technology to Dublin, to Ireland. I mean, obviously it's easier for you to access it, but it also opens it up to a whole other group of patients in Ireland. Can you talk a little bit about your aspirations there?
Yeah, well, we entered into this whole project as sort of very naive, open-minded learners, and started to get the sense that the physiology people go to physiology conferences, and the robotics guys go to robotics conferences, and the scientists go to science conferences, and business people go to business conferences. But we need all of these people together. So that was that's where the project kind of came from, and that robotics, adding in next stimulator and the drug, it was the first time it had ever been done in the world. So when I left Los Angeles back in May, it was like having the chance to drive a Ferrari and then going back and cycling in Dublin. I wanted to have it, and it also goes back to the beginning. I didn't get competent at skiing skiing to the South Pole by sitting down in my wheelchair. You know, got good at skiing by skiing and good at rowing by rowing. So the question that we've got here is, you know, we did sort of 3 months, and it was really only the last couple of weeks that we had all of the stimulation, the robotics, and the drug in working together. So the question is, what happens over 12 months, 24 months, 36 months? There will be a training effect, we suspect. So I wanted access to it, number one, and we're going to try and get that collaboration going now with UCLA and also back in Dublin, which is why I'm delighted to be talking to Science Foundation Ireland, having met Ruth and sitting out there trying to build on this collaboration. So we want it back in Ireland, and we also want to make Ireland a centre for this kind of research and spread it out to maybe 6 to 8 patients, not to do research for research's sake, but in fact to get this stuff into human beings as quickly as possible, to commercialise it. And Nick's company, Neurorecovery Technologies, houses all the IP. They're raising money, you know, so I'll do the sales pitch. If you want to invest, there's a great investment here for anyone out there. But we want to get the research going in Ireland to help with the FDA approval, to help the company become successful, and to get it into patients. I'm not involved with the company. I'm a paralysed person with backing, with support, and there are people, I'll give you a statistic in Ireland which has just come out, 75% of people in Ireland, the Western world, never work again. 4 out of 10 with spinal cord injury in Ireland live below the poverty line. You know, this is not a good story. This is a human crisis, and it's going to require collaboration across geographies, across organisations, and across disciplines. But we're right here, doing one of the cutting-edge research projects, and we want to get that back to Ireland.
Yeah, no, and I mean, it's been great for me as SFI to meet with both of you and have a bit of time to talk, because, you know, we've been able to talk about some of the programmes that we have in Ireland to work collaboratively in a very flexible way with companies in an effort to try and get more impactful research into Ireland. So I guess we can thank the IIBN for forcing us to have the more detailed conversation, which has been great. I know people might have some questions, so we are going to try and have just a minute or two for questions, but I think just before we go on talking about the funding, Mark, because that's obviously been a big part of the Trust, and I don't know if you just want to say a few words about the current funding, and I guess we've already talked about maybe some of the future funding that's needed.
Well, unless a pot of funding suddenly appears that I don't know about, there doesn't seem to be any funding for this collaboration role. So back at home out of Dublin, friends of mine set up the Mark Pollock Trust, and in order to create I'm a business person, I'm not a scientist, but in order to create a funding stream, we set up a running event, and that running event is happening on Wednesday night. It's called Run in the Dark, and it happens in 40 cities now around the world, including in New York at 8 o'clock on Wednesday night. But we've got a little video to explain what it's about. Could we play the run video, please? I'm blind, I'm paralysed, but I want to walk again. As darkness sweeps around the world on one evening in November, thousands of runners will join our mission to fast-track a cure for paralysis. Join us in your city.
Thank you. Now, I do want to open up the floor to questions, because both Mark and Nick have kindly agreed to take them. So does anyone have any questions they'd like to ask? Hands up there. We were too clear.
Don't leave us hanging.
Yeah.
My nephew was recently paralyzed.
July 3rd, my nephew was in a surfing accident, was paralyzed. He shattered his C5 and his C6 vertebrae. I'm currently just new to this whole arena, obviously. And do you have any advice or suggestions for a 13-year-old boy who is trying to deal with this situation right now?
Well, I think what's going to happen, or what has been happening, I would imagine, is that everyone, in my experience, gets really worried about offering false hope, and I suppose where that stems from, the head psychologist, an Oxford University psychologist, told me when I was in hospital, you know, that I really needed to focus on the acceptance. And I think we do need to acknowledge and accept that there is no cure right now, that it is what it is. But I think it's reasonable to run acceptance and hope in parallel. So I think what your nephew will need to do is accept wherever he is as a starting point, and your family, and I'm sure his parents are struggling. I think we all need to accept what the starting point is and work from there. Physical exercise, there's no doubt that keeping in good nick, keeping the muscle mass, you know, if we fix the nervous system but he's got no muscles left, there's going to be a problem. So he needs to follow some kind of physical exercise regime. Then Nick needs to raise the money and get the stimulator done, and we need to get this stuff out of the theory, out of the labs, and into people. But I think it's acceptance is very, very important, and then hope as well in parallel.
Yeah, he needs to stay in a very active physical therapy or rehab program when he goes home. The more healthy he sustains himself, the better prognosis it will be in the long run. So to put in perspective where we are, so our company was established as a technology transfer out of the university systems, and we're moving it off campus. So we finished the first phase of commercial development, and now we're raising the money to get into the final phase, which is to make the definitive product that is brought before the regulatory agencies. To do that, Mark and I are teaming up now to try to advance this process by doing a new study. And you might say, well, how is that going to help with commercialization? Every little piece of the puzzle that we put together advances the project. And we can go over to Ireland, we can get CE mark, we can get approval here, and we can deliver it to all these patients in need. We are, with the right funding, we are 2 years away from bringing the external system to the market. And then the implantable can follow behind that. So we're close. We're really at the front door.
Is there one last question out there before we have to wrap up? No? That's good. Okay, well look, I guess it just remains for me to really thank Mark and Nick. It was a real privilege to be up here chatting to the two of you, and I'd just like you to thank them both.